Hello friend, welcome back on our YouTube channel A Man in My God, and today in this video we are going to learn about enuresis. Enuresis means bedwetting, means let me understand from the definition. Enuresis is involuntary passage of urine beyond the age when bladder control is expected, usually 5 years. So usually at the age of 5 years we expect that the baby will not do bedwetting, but it's involuntary moment. Baby don't want to do bedwetting, but because of it is not in his control, and unfortunately he is doing bedwetting. So it's called as urinary. So hope you understand the definition. So next topic is etiology. So what is the causes of this enuresis or bedwetting? So first one is genetic. It's a kind of genetic. Then deep sleep pattern. So it's depend on the sleeping pattern also. Then psychological. So any type of stress will be there. So it's chances to happen the enuresis. Then UTI, if the urine tract infection will be there, so it's chance to have ureasis or bedwetting. Then the constipation or the bladder capacity, so it depends on the capacity of the bladder. If the bladder is small and it's filled within hours, so it's means chances to having bedwetting or ureasis. So hope you understand the etiologies, means causes of ureasis. Next the topic is classification. So let me classify this enuresis. Which type of enuresis are there? So there are basically four type of enuresis. First one is primary, then secondary, then nocturnal, and the fourth one is diurnal. So here in the primary enuresis means what is written here? Never control. So when it means from the birth of the child to till death, means at the age of 8 year, 9 year, anytime, means it's never control. It's continually doing enuresis or bedwetting. Then secondary means it's control for 6 months or less than 6 months, but it's started again. Means bedwetting is started again. Then the nocturnal. Nocturnal means at night. It's a very common. Means most of child have this type of enuresis nocturnal. Then diurnal means bedwetting during daytime. If the baby is sleeping at daytime, he will definitely do bedwetting. So it's called as diurnal bedwetting. So it all follows the type or the classification of enuresis. Let me understand. Clinical manifestation means signs and symptoms. How a nurse can or how anyone can recognize that he is doing bedwetting or no. So in the clinical manifestation, first one is bedwetting during sleep. So whenever the baby is sleeping, he will do bedwetting. It's the clinical manifestation. Then daytime wetting, when the baby is doing bedwetting at daytime. Then the low self-esteem. So if baby has the low self-esteem, loss of self-confidence, means he don't have his own respect, the value of his own self. So it is called as low self-esteem. Then the anxiety, because of the anxiety, its chances, means it's a manifestation, means feature. A baby has, if the baby is having anxiety, it means it's doing bedwetting. Or the embarrassment. So when you are the group or the family are talking about bedwetting, so a baby will feel embarrassment. So features of the clinical feature of that enuresis. So then diagnosis, what the nurse can do, how they can recognize that the baby is doing bedwetting. So means lab investigation we can also say. So first one is history taking. We have to take, the nurse have to take history of that baby. Means when he's sleeping, what he eating, what his parents do, all the things. Then the physical examination. Then the urine analysis, means if in chances of infection will be there, suppose there UTI, so we have to check their urine analysis. Then the ultrasound in the severe case, and if any bladder problem, so chances to do ultrasound. Then after diagnosis, we have to discuss about treatment. So what is the treatment of this enuresis? So treatment have two types, non-pharmacological and pharmacological. Means non-pharmacological means we will not provide medicine to that baby, and pharmacological means we have to provide medicine. Non-pharmacological, first one is fluid restriction before bedtime. So a mom have to don't give any kind of food to baby before the bed. Then regular toilet schedule. A mom or the nurse have to maintain the regular toilet schedule. Means after 2 hourly or 3 hourly, nurse or the mom have to uh, encourage the baby to do toilet. Then wake child at night to urine. So it's very common. Means wake the child at the night for the urine. Then bedwetting alarm, or we have to keep the bedwetting alarm during 3 or at the midnight, because the parents is sleeping and the baby is sleeping. So parents will also not get up at night. So they have to keep the alarm also for the bedwetting of baby. Then position position reinforcements reward system, means if the baby is not doing bedwetting at night, so in the morning our parents have to give something or some toys or anything like a reward for the baby. So it was the non-pharmacological, or now pharmacological. This we have to give medicine. The first one is desmopressin. Our first medicine is desmopressin, which is common medicine, and the imipramine. Imipramine is rarely used. It's very rarely used if bedwetting means 10 year or 12 year of baby is doing bedwetting. So it's this type of medicine they use. So here after the treatment, suppose they will not do treatment. So what was the complication? Means in severe cases what will happen? So let me understand what is the complications. The first one is psychological stress. So if the baby is doing toilet or the enuresis at the age of 10 year, 12 years, so automatically he will psychological stress will be there in the baby. Everyone not doing toilet at bedwetting. So why I am only? So if this kind of stress will be there psychologically, then the low self-confidence, and the baby will don't have the self-confidence. So very low self-confidence, because in the society or in the family, everyone whenever talking about the bedwetting, he will feel embarrassed and his confidence will be very low. Then the social withdrawal. So because of the respect and the embarrassment, he will be socially withdraw himself. Means he will like to isolate himself, because suppose in family everyone is talking about the bedwetting, so he feeling embarrassed. So how means why he will go there? So socially withdrawal will be seen in that type of baby. So it was the complication of enuresis. Next one is nursing management. What a nurse can do for manage this type of enuresis. The first one is reassure child and the parents, not child first. So a nurse has to reassure the parents and child that it's not your fault, baby. It's natural, it's ecological, because of the stress or infection, anything, it will be treatable. This kind of means a nurse has to encourage or reassure the child it's not his fault. Then maintain privacy and dignity. A nurse has to maintain privacy of the baby. Suppose the baby's age is 10 year, 12 year, and he do enuresis. So it's his privacy. Now in this age, he has some self-respect, self-esteem. So a nurse has to maintain his privacy and dignity for our dignity. Now the next one is educate about bladder training. So a nurse has to educate the parents about what is the bladder training, how to keep alarm at night, all the things here, whatever is non-pharmacological management. Then encourage fluid management. So a nurse have to encourage the fluid management before time. We don't have to drink more water or anything like fluid. Then provide emotional support. Nurse have to provide emotional support. Then the last one is avoid punishment. So it's not heavy fault, so there is not any chances of punishment. It's a natural process, it will be treatable. So avoid punishment is there. Then the last one is prevention. How a nurse can prevent, or how we can prevent this type of disease, or we can say the urinary disease. How we can prevent? So first one is proper toilet training. Where we have to provide proper toilet training after the age of 1.5 year or the 2 year. Then avoid fluid at night. So it's very basic things, means avoid fluid at night, because of the fluid there is chances of enuresis. Then the stress management and treat causes. So nurse have to provide stress management, or anyone have to provide stress management and the treat causes, means whatever the causes here, or either the genetic, UTI, constipation, blood capacity, other physical or psychological stress. So we have to treat that causes. So it was the enuresis, and about the enuresis, hope you understand this type of system of enuresis. What is the definition, etiology, treatment, and prevention, everything. So if you want to means change anything, or if you want to just advise me, so please advise me. I will be very thankful to you. And thank you for watching this video till the end. So see you in next video. Change.